Hello, my name is Dr. Harbpinder Shevchenko from Smiles by the Sea in Hampton, New Hampshire. And I do get asked a number of times questions about dental implants, and I am going to be answering some of those questions today. So, what are dental implants and when are they recommended? So, I'm going to answer first, what are dental implants? Dental implants are a procedure basically to restore a tooth back or multiple teeth back if somebody has lost a tooth or teeth because of various reasons. When are dental implants recommended is that if somebody has lost a natural tooth or multiple teeth, to basically bring that function back, to give somebody the tooth structure back, dental implants are done. Dental implant basically consists of three parts. So just imagine like a natural tooth structure has a root, which normally we don't see. It's hidden in the bone, and it's a basically anchor. And the part of the tooth that we see, which we normally call it a tooth. So that is the implant is three parts. It's a titanium post which goes in the bone, and there's a connector piece, and then is the crown. And crown part is the one that actually you see in your mouth. So dental implant it consists of three different pieces which all get connected together, and you have a fixed functioning tooth in your mouth. So what conditions might disqualify from a person getting dental implants is one of the very first biggest one is that if somebody does not have enough bone, and also the bone cannot be reproduced in that particular case with the procedures that are available these days. Also some medical conditions like somebody who has a on blood thinners, and we cannot take that patient off of blood thinners, and since it's a surgical procedure, we want to make sure that there's no complications can happen. And the other thing is in mostly happens in women who have a disease called osteoporosis where the bone does not heal. So in that case, we are not able to give dental implants as well too. So the risks and benefit of dental implants, I will explain the benefits first. The benefit is that if somebody is, let's say, missing one single tooth, the biggest benefit is that we are able to restore that tooth back in your mouth without touching any of the neighboring teeth. So that is one of the biggest advantage or benefit of if somebody is missing a single tooth, giving you a tooth back. And also the other big benefit is that let's say somebody is missing multiple teeth and they want something fixed in your mouth which can literally function as your own natural tooth. So multiple implants could be done, or an implant supported bridge could be done, and you will not feel that there's anything moving in your mouth. It will feel exactly like your own tooth. And obviously they are very aesthetic when the crown goes on top, so that is another added benefit of those. Some of the risks could be that if somebody has a narrow bone, the implants can fail in the future, or somebody who has a lot of health issues, those could be some of the risks that somebody can run into. So the different dental implant procedures are, again, like, is it a single tooth, restoring a single tooth implant with a single crown, or it could be an implant supported bridge, or it's an implant supported denture in your mouth. So how will a dentist decide if the dental implant is the right procedure for you is basically looking at the risks and benefit in the area where you're needing the implant. They will look at, okay, if let's say if somebody is missing just a single tooth and you have a healthy teeth around it, so in that case, implant would be the best option for you because we won't be touching any of the neighboring teeth. You get to maintain your natural teeth and you just get replacement for that tooth. The other thing is that some of the patients don't like anything moving in their mouth, or the work that they do, that may not allow them. Like for example, if somebody's singing, they're using an instrument, and if they're missing teeth and they want to restore their teeth, implants would be the better option for them because they're fixed and they will be able to perform their functions better. So some of the considerations that dentists might take into giving you the treatment option for an implant. So some of the other options available for getting artificial teeth is would be that you can get a bridge done. If you're a single tooth missing or two teeth missing, we could use the neighboring teeth as anchors, and they can be used as a restoration to replace that missing tooth. Other option is partial dentures or full dentures. How long a dental implant procedure lasts? It could be anywhere from 30 minutes to hour and a half, depending on how many implants you're getting done. But typically, after you get numb, it's a very quick procedure. And also, depending on if somebody wants to be asleep, then it might take a little bit longer. But it's typically done in 30 to hour and a half, depending on how many implants you're needing. So, is dental implant procedure painful? I would say no, it should not be painful because we want to make sure that you're fully anesthetized, you're fully numb, and you don't feel anything that is going on. And also, if you would like their availability of, might be using a nitrous oxide gas or even putting you to sleep. So you're not even aware of what's going on and you wake up and your procedure is done. So what anesthesia options are available for dental implant? There are multiple options available, starting from the very basic one. If somebody wants to stay awake, and then it could be just the regular, what we call as a Novocaine or lidocaine, where your tooth or the area will get numb and you basically won't feel anything, but you're aware of what is getting done. Other option is you could get what is called as sedation dentistry or a general anesthesia, where you could be put to sleep and you will not know what happened. Basically, you will get up when the procedure is done. Will the dental implants last for the rest of your life? Yes, if they're well taken care of, they're there for, they just basically become part of your mouth and they can last you whole of your life. So does most insurance cover the cost of dental implants? It could be yes or no. It really depends on what policy you have, what type of plan you have, what coverage you have. Most of the dental insurances these days, they have certain percentage or that they pay towards the procedure. But remember, dental insurance is just a benefit. It's not covering all your risk. So depending on what plan you have again, and certain percentage towards the procedure might be covered. So I hope I answered most of your questions about dental implants and the related procedure. If you still have any questions or need any help, feel free to call us at 603-926-8827 and we will be happy to help. Or you can also visit our website www.smilesbythecnh.com and request an appointment, fill out the form. You may also be able to write down any comments you have, and then we will be happy to reach back out to you and help you with whatever your needs are.